In this video, I answer a question from Evan from LinkedIn that has been diagnosed with a partial tear in his rotator cuff muscle and is trying to decide if surgery is going to be the best option. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical expert in chronic pain treatment, specifically for conditions affecting the neck, shoulder, low back, and hip. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long-lasting pain relief. All right, so this week's question came from Evan on LinkedIn. Let's read it. I'm 36 years old and enjoy lifting weights and trying to stay active. I've been dealing with some nagging shoulder pain for the past year or so, which seems to get worse anytime I do any overhead pressing. A few months back, I went to reach for something in my back seat and felt a sharp pain in my shoulder, and I could barely move it for a few days. Once it settled down again and I can move it, I went back to the gym and all the pain was back, but worse. I started with my primary care doctor with a round of anti inflammatory medications. When that didn't help, I was sent to physical therapy. All the exercises only made the pain worse. I then went to an orthopedic doctor who gave me 2 rounds of cortisone shots, which did help with the pain, but not the movement for about 2 weeks. Finally, they did an MRI, and I have a partially torn rotator cuff muscle in the supraspinatus, and the doctor is recommending surgery soon as all the other treatments didn't work. My biggest concern is that I never had a direct injury to the shoulder, yet it still got messed up. So, is surgery going to be my best option? Also, the idea of being in a sling for 4 weeks and doing nothing sounds terrible. Any insights or advice would be greatly appreciated. Thanks so much for sending that question in, Evan. Just a quick reminder, if you do have any questions or are looking for answers specifically on neck, shoulder, low back, or hip pain, then send a message to me. And if my insights can help, I'll be sure to get a video out to you. All the information to do that is in the profile or wherever you're consuming this video. All right, so let's get right into it. These are my favorite type of injury presentations and cases, especially injuries where there's no real mechanism of injury or real cause. So let's break this down very basically. So what kind of happened here? So the first thing that happened, Evan's very active. He does a lot of stuff. When this happens, your muscles get overworked. They don't get enough blood flow. They don't get enough oxygen. They send a signal to the brain. The brain goes, hey, what the heck's going on here? Must be a problem. Starts to pump out these immature fibers that are called collagen, also known as adhesion or scar tissue. Eventually, it gets inside the muscle. When it gets inside the muscle, especially the muscles around the rotator cuff's made up of four different types of muscles, and they're all important in stability and movement in the shoulder. Then what happens is the adhesion gets inside there like a glue, and first it makes the area less flexible, and then it makes it weaker, bad enough. But then the problem also happens is blood flow can't get in, all the good stuff, and then all the bad stuff can't get out as well. So a lot of times this starts just in the muscles, just from overuse, overextending yourself and things like this. I tend to see this a lot in people that are very active, do a lot of weightlifting, a lot of physical activity. You don't really notice it at first when this is happening. Maybe your muscles are a little more sore than normal after a workout. Usually have to stretch out a little bit more, maybe a little more foam rolling, but like nothing too bad that you really notice a lot of pain. Then what happens as well, as those mechanics in the muscle and the muscle just can't produce enough force, it starts to dump more force to this ligament in the shoulder. It's called your capsule. And the capsule is really big in like shoulder stability, movement, biomechanics, and then that also starts to develop some adhesion as well. Now the shoulder really can't move how it's supposed to and causes a lot of issues. So there's adhesion in the muscle, there's adhesion in the ligament, range of motion starts to get limited, maybe workouts are a little more painful, maybe you even see some like diminished gains in your lifts and stuff like this. Like you start to pay attention a little bit more, maybe you cut back on the amount of reps, the amount of weights in hopes that it will kind of get better on its own, but it really doesn't, and then it starts to progress. Then what else happens is eventually, as that adhesion gets bigger and bigger in the muscle, it does get stuck to this nerve in the rotator cuff. It is called the suprascapular nerve. And the suprascapular nerve is really important in moving two muscles in the shoulder. The first one is going to be the infraspinatus, which is below, basically in the shoulder blade itself. And then the other one is going to be the supraspinatus muscle, as well. And its job is really to just provide movement and stability there. So when the nerve gets compromised, now the muscle isn't getting the signal it needs to. So it starts to shut down that range of motion even more. And a lot of times maybe the shoulder will like roll forward to take pressure off of the nerve. Because when the nerve starts getting entrapped and causing problems, that's when bigger problems happen. And the body goes, hey, we got to do something about it. You get more inflammation, you get more pain, you get more dysfunction. So what happened with Evan here is he's got a partial tear of the supraspinatus. It's the muscle on top of here. It's actually one of the four rotator cuff muscles, and it sits on top of the scapula in there as well. So essentially, what happens is when there's a lot of adhesion in the capsule itself, and then the infraspinatus and that suprascapular nerve, what happens is the force has to go somewhere. So it ends up going to the supraspinatus. And the supraspinatus just has like one basic job, just to kind of lift the arm up just a little bit. But then what happens is over time, it just starts to take on more and more force because these other muscles and these ligaments aren't doing their job because they're just compromised with all of that adhesion. So the force has to go somewhere. And a lot of times where it goes is out here on the side of the arm here, like deep to the deltoid into the tendon itself. And that's where you start to get some of that tearing, and it shows up on the MRI as well. It's just not designed to take on all that load, and then it just puts it in a bad position. Plus, that shoulder's rolled forward. So it's in a bad alignment too, which in turn is going to put more pressure on there as well. Then it starts to develop this thing called a tendinosis, not a tendinitis. Most people say tendinitis. That isn't true. A tendinosis is when more force is being put into a certain area. So the body actually starts to lay down more fibers of that tendon to help buffer the area, but it's not good quality fiber. It's kind of like lackluster, not the top notch stuff, but it's just trying to like do whatever it can to help that shoulder function and move better. And what happens over time is most rotator cuff tears, partials, complete tears were a tendinosis to start in the beginning. And a lot of times it actually misses out on that because the doctor doesn't diagnose it correctly. They say it's tendonitis. And their favorite thing to do for shoulders is to do cortisone shots to go in there and take the pain away. But it's actually shown with studies over time that repeated cortisone shots actually degenerate that tendon more and cause bigger problems down the road. Maybe a big conspiracy theory that maybe these orthopedic doctors are trying to make things worse so they can do a surgery on the back end. But I won't get into all of that in this video because we could be here all day with me rambling about the nonsense of the current medical model. So, why might surgery not work or make the problem worse? First is just this cause and effect. A lot of times, like I said, the supraspinatus is getting jammed up because other things aren't working. So that's the effect. It's not the true cause. And that could be a problem because if you're only addressing where it hurts instead of what's actually happening, it could cause bigger problems. I was talking about this idea of like the thumb in a car door analogy. So I say, think of like the partially torn tendon or the joint or the cartilage is like your thumb stuck inside a car door. The car door is all the adhesion, the nerve entrapments in the muscles and the ligaments and the nerves surrounding there. We can't give this a chance to heal up until we remove that. So when you have surgery, it's like they pull the thumb out of the door, but then the door slams right back down, which is why this surgery doesn't usually have a very high success rate. Next is just understanding all the risk factors of surgeries. These surgeons come in and they have like this God complex, like, yeah, we'll just sew you up and go here, you'll be good to go. They never tell you about the risk factors of you get an infection, you could have a reaction to the anesthesia, you might not even wake up. I mean, that's not as common, but hey, it could happen. Next one is just being out of commission for several weeks. You're going to be in a sling. You're not going to be able to use your arm. You're going to have trouble showering, getting dressed, going to the bathroom. Hopefully you have someone, if you're considering surgery, you have someone that really loves you and wants to help you because that stuff's going to get old after a while. Because the other thing is they could go in and fix that area, but it could actually make it worse because it only treats the effect. It's like that car door slams down right away. So how would I go about fixing this and addressing this in my own clinic or any of the other providers I train around the world in the peak method? First is we would just start with a thorough history and functional evaluation to know exactly where the problem is occurring. We want to get to the cause, not just the effect. If we only treat where it hurts and not where the problem is, it's going to come back. Next is once we figure out exactly where the problem is, where the nerve entrapments are, where the adhesion is, we take a manual-based treatment approach to break down the adhesion, which will restore range of motion, functioning, promote healing, get blood flow, oxygen to the area, get all the waste product out of there. Next is once we do get it healthy, and we get the tissue more healthy, we're going to build up some strength and those other muscles around the rotator cuff, specifically like the infraspinatus, the teres minor, the subscap, more of like a corrective type of exercise. Because remember when I said when you have adhesion, it first makes it less flexible, but then it makes it weaker. We want to build that up. And a lot of times people start with physical therapy when the tissue isn't healthy. We get the tissue healthy first, then we build the strength back up. Once we do that, then we build up the global strength with more compound movements, like pressing, pushing, carries, like things like that to build up more stability and make sure this problem doesn't come back down the road. And then this one, I always say this to clients too that are coming in and they're trying to figure out if they want to do surgery or not. I give them like a best case, worst case scenario. I say, hey, best case scenario, we treat this for a handful of visits, go in there, restore range of motion, get things moving better. You avoid surgery, avoid the risk from that. Worst case scenario, we get all the tissue cleaned up, we get it moving better, but you're still having pain, then go have the surgery. It's actually going to make your rehab process, your recovery a lot better, 50 to 75% better. But if you just jump into the surgery and you don't get any of this tissue cleaned up, the problem's going to continue to come back down the road, which we don't want to have. Nobody wants to have that. That's just something that is a really big pain in the butt. So that's all I got in the video. If you're sick and tired of dealing with chronic neck pain and wasting time, chronic neck pain, I guess shoulder pain, anything like that, and wasting time and money on treatments that never seem to produce any long lasting pain relief, then click the link in our profile to learn about our specialized treatment process that helps get long lasting pain relief results without having to resort to medications, injections, and surgeries. And you can request a no charge injury consultation from one of our dedicated providers to get some real answers about the pain and on the path to feeling and functioning a heck of a lot better. I appreciate you watching the video, and I will catch you on the next one. Bye.